Welcome to the NDTV-Fortis Awareness Campaign Health for You. For most affected Indians, diabetes is an acquired disease due to an unhealthy lifestyle. But for most children, it is a condition that they are born with. Type 1 is the most common form of diabetes in children, and with no known causes and no cure, it is a chronic condition that they must live with.
Last year, 5-year-old Tanishka started coming home from school exhausted. She complained often that she was thirsty. Tanishka's parents were quick to realize that something was wrong and took her for a blood and urine test. Tanishka had type 1 or juvenile diabetes, as the name suggests, most common in children. It is an autoimmune condition that destroys the insulin-producing beta cells in the pancreas. In the absence of insulin, the body is unable to process glucose as fuel, and sugar levels in the body increase dangerously. The symptoms are quick weight loss, frequent urination, increase in appetite, lethargy, and vulnerability towards fungal infections. With no known history of the disease in the family, her parents were shocked that Tanishka had been suffering for about 4 months. Such children present symptoms overnight and can go into diabetic coma without medical intervention. She had to immediately be put on insulin and pulled out of school.
We were afraid, because type 1 diabetic patients go into hypoglycemia. And in school, you never know, a small child cannot explain to a teacher that her symptoms are like she'll feel hungry, or she'll sweat, or she'll feel weak. So maybe she'll not be able to explain her teacher or friends that what are the symptoms. Give me some sugar or glucose tablet.
They homeschool Tanishka and monitor her diet strictly. No sugar and low carbohydrate food.
Painting करती है, drawing करती है, dancing, watching cartoon, always.
स्कूल मिस करते हैं?
बहुत ज़्यादा स्कूल मिस करती है, अपने फ्रेंड्स को हमेशा याद करती है.
So that children like Tanishka do not have to drop out of school, Project Kids by the Public Health Foundation of India has begun an awareness campaign to train teachers about type 1 diabetes, inform students about type 2 diabetes that's largely caused by an unhealthy lifestyle.
First, we have told them as to what are the symptoms to identify that a child may be type 1 diabetic, because they are the first ones who would realize if a child is lethargic in class, or is drinking a lot of water, or is having frequent urination. Then they can always suggest the child's parent to take him for a checkup. So we realized, and this actually came from teachers, that yes, they were the ones who could notice these symptoms much earlier. And then we have given them tips like this child would require a mid-morning snack, what are the kind of emergencies this child can face in the school, and how to tackle those immediately in the school setup.
Teachers do consider all this, and whenever a child feels like having anything, we don't have any objection to it, and they are allowed to eat something in between also if they feel like, and they take permission, they are allowed to have something.
Project Kids started last year in 15 schools across Delhi and now plans to go national. From poster competitions to street plays and quizzes, Project Kids is engaging school children in several activities surrounding the causes and cures for diabetes.
There are 3 types of diabetes: type 1, type 2 and gestational diabetes. Well, in type 1 diabetes, the pancreas stops giving insulin, and we know that insulin is essential for our body. And in type 2 diabetes, the pancreas give less insulin. We do not get enough insulin. And in the third type, when a lady is pregnant, they get enough insulin, but they're not able to take that insulin. So these are the three types of diabetes. Even one of my teacher, so I always tell them that if you'll not do this, you'll get diabetes. Junk food and being lazy, not doing work, like you're lying down and you're telling that please can you get me a glass of water and all, and not doing the work on your own.
In children with diabetes, nearly 70 to 80% suffer from type 1. But doctors today are concerned that type 2 diabetes may be equally threatening.
We are getting kids in the first decade of life, definitely in the second decade of life, with classical type 2 diabetes. It was never there. When we were growing up and being trained as doctors, it didn't happen before 40 or 50. It's happening at 10s and 12s. It's unbelievable what we are seeing now. And clearly second decade type 2 diabetes has come to us. Right? There are countries in the world like Japan where now in childhood type 2 diabetes is commoner than type 1 diabetes. We've not reached that stage, fortunately, but it was 0% type 2 diabetes a few years ago. It's now 15% already. So one worries about that.
The biggest cause of concern, there is a very limited range of medication available to manage type 2 amongst children.
Approved medication is only metformin. And if you don't get control of metformin, you're on to insulin. Actually, there is no approval for any other oral medication for children with type 2 diabetes. So it's a very rapid transition from oral to insulin. And therefore, prevention of childhood diabetes is therefore a very, very critical part, perhaps even more critical than preventing adult diabetes, adult obesity.
Obesity is the leading cause of type 2 amongst children. Over 20% children in our cities suffer from a condition known as Syndrome X. Syndrome X is a metabolic syndrome marked by obesity, high blood pressure and insulin resistance. Children are predisposed to the syndrome if either parents have diabetes or if the mother suffers from gestational diabetes.
In India, healthy is fat actually. So we have to make the child healthy, and they feed, and by the time 6-7 years old, he is obese. And this is the worst thing to occur, because the studies have shown, tracking this children from birth to adulthood, have shown that the moment 6-7 years obesity occurs, they are going to develop diabetes in 20s and 30s. So this sickly child becomes so-called healthy according to mother, but actually is unhealthy and will develop diabetes, hypertension, heart disease way too soon.
Coming up next, a growing number of India's expectant mothers are being diagnosed with gestational diabetes, a huge health threat to our progeny.